My name is Naghmeh Niktoreh. I come from Iran and I'm a doctor. Using a stipend, I have the possibility to work and research in the research lab of Professor Reinhardt. From a normal blood cell, when changes in a gene happens or a gene is damaged by any reason, can a cancer cell arise. Depending on what kind of changes in the genes we have, a prognosis, that means a prediction of the outcome for the disease can be made, and we can say what kind of treatment and what kind of experiments we can use to treat this kind of disease, special kind of disease. There are some specific changes in the genes that when they happen, the possibility of the patients to have a relapse is much higher. Nina, one of our patients with a special kind of leukemia which could not be treated with the conventional treatments that we have. In our reference lab, we could identify a special marker in her cancer cells. This marker is called FLT3-ITD. And using a targeted therapy, we could treat these cancer cells directly. With this treatment, we could bring Nina to a complete remission. That means that she didn't have any more cancer cells in her blood. And using this situation, doctors in Essen could perform a stem cell transplantation for Nina. After stem cell transplantation, her conditions have improved greatly, and now she's doing very well. I'm working on a special change in the gene which is called WT1. If WT1 changes in the genes of the cancer cells, in addition to other co-occurring factors, all of the children will get a relapse, no exceptions. And from these patients with relapse, only 1/3 can be treated with our ongoing treatments. This cannot stay like this. And this is the reason I'm spending my time and trying to research and understand what is the reason behind this change and what are the consequences of this change of gene in the cancer cell. Especially with what kind of treatments we can kill these cells in the best way possible, and hopefully we can treat more patients.